Our next speaker is Janet Burgess from Australia, who's going to talk about the extracellular matrix in lymphangio-leiomyomatosis.
Thank you. I'd like to echo other speakers' comments, congratulate the organisers on a fantastic meeting and thank them for giving me the opportunity to present this work today. I need to acknowledge all of the people listed on the slide, who are all important contributors to this project and have been vital for its progress. Lymphangio-leiomyomatosis is a disease of the lymph vessels and bundles of smooth muscle-like cells. It's a fairly rare disease, affecting between 1 and 5 in a million, and generally is found in females of between 25 to 40 years of age. It's characterised by cystic destruction in the parenchyma, but also regions of fibrotic deposition. It's also thought that there may be a metastatic component to this disease, and it's found, or the cause of this disease is a mutation in the tubular sclerosis complex. But we're now beginning to understand the role of the extracellular matrix. So this talk's going to follow on from the theme that we were developing yesterday during the poster discussion about the role of the matrix in regulating cellular behaviour. So in LAM, we know that the interstitial tissue is negative for smooth muscle alpha-actin. There's collagen and fibronectin deposition in these tissues, and there's also alterations in other extracellular matrix proteins. Particularly elastin fibres have a peculiar relationship with some of the smaller matrix proteins, and they're absent in regions where other matrix proteins stain strongly. The extracellular matrix is a very complex beast. We think there's probably about 300 proteins that make up the extracellular matrix in different tissues. I'd like to focus today on the collagen fibres, fibronectin, and another smaller protein, Perlecan, and also Fibulin I and a number of other small matrix-associated proteins. So the extracellular matrix has traditionally been thought of as a structural support, provides the framework and stability for the tissue, but there's a lot of emerging evidence that this is actually a bioactive entity. There's bidirectional communication between the matrix proteins and the cells, and the characteristics of the matrix can regulate cellular behaviour. So we've been interested in understanding the changes in the matrix in the lamb tissue, and we've started out by looking at collagen I. And we're using a technique called second harmonics generation. This is using the natural fluorescence of the collagen to give us a fluorescent signal. So in these images, the yellow is the autofluorescence, predominantly of the mesenchymal cells, and the blue and the pink fibres are the collagen fibres that we're looking at. And they appear to be different, as one of the fibres is the organised fibrillar fibres and the other is the disorganised fibres. And we're getting different optical parameters from these, which is enabling us to distinguish between them. When we use computer algorithms to calculate the density and the area of the staining and perform a ratio of these two different types of fibres, with looking at both area and intensity, we're finding no difference between our control non-diseased tissues and the lamb patients that we have. So probably in this particular instance, the collagen I is not different in the lamb patients. We've then used more traditional detection methods, so immunohistochemistry with DAB detection being the brown staining, and we're looking at fibronectin deposition in the tissue, and again, our non-diseased and our lamb patients. Using standard densitometry, looking at the area and the density of staining, we're not seeing a statistically significant difference in our patient groups as yet, but we have got small numbers. And at the moment, this non-disease group also has male individuals in it, so we need to increase the number of females, which are the more important control group. We've also looked at Perlecan 5, which was another matrix protein I highlighted for you in the original imagery. And again, we can see with the brown, quite strong staining in specialised regions within the lamb tissue, but also in the non-disease control tissue. In this instance, we are seeing an increase in Perlecan 5, and we think this may be important in terms of how the matrix structure is formed in the diseased tissue. However, again, when we look at just the female control groups, we haven't got significance as yet, but we need to increase these numbers. So we're now interested in, rather than the overall amount of these matrix proteins, are there changes in the way they're structurally deposited into the extracellular matrix? So we've become quite interested in two small matrix-associated proteins, periostin, that we've heard an awful lot about here at this meeting, and another protein called Fibulin 1, which we had some work in IPF in a poster yesterday, which is still out there if you're interested. So we've looked at these two proteins, and they're important in the formation of the fibres of collagen and fibronectin. So here we can see for Fibulin 1, this is staining in lamb tissue, quite strong staining throughout the tissue. And I refer you to the poster to be able to see the staining in non-diseased tissue. And this is periostin staining in the lamb tissues, again in very specialised regions. When we quantify the periostin staining, again, we've got quite a diverse range of staining across the patient groups, and we're not seeing a difference between the disease and the controls with this particular group. We've yet to do the analysis on the Fibulin 1 staining. But these matrix proteins that we've looked at to date have been deposited into the extracellular matrix, and we know that fragments of these proteins or even whole proteins can be released and have a role as a soluble protein, and quite often that role is different to the role that the protein plays when it's in the deposited form. So we've been looking at the soluble proteins and looking at soluble Fibulin 1. This is our control protein, our lamb samples and our female non-disease controls, and we see a significant increase in the amount of this soluble protein that we can detect in our lamb patients compared to the non-diseased. And the colouring in these samples indicates lamb patients that have been sourced from two different locations. The green is patients from Sydney, and the orange are actually patients from here in Modena. So we're seeing very similar patterns in two different cohorts here. The other side of the matrix story is always the enzymes that have the capacity to regulate the matrix proteins. So we've been looking at some of these, and we've found, as is reported in the literature, that MMP2 is increased in the lamb patients, and again the black are those that have been sourced in Australia, and in this case the blue, one here and one here, are the patients from Modena. And we've also looked at cathepsin K, and this is just looking at the levels of it that we can detect in the tissues, and in this case we're not seeing a difference, although cathepsin K levels are reported to be different in the literature. So we've been looking anecdotally at the matrix proteins, but we're very interested in what's the functional role of these changes in the matrix, and we're very interested in the lymphatic involvement in lamb. So we know that there are cells positive for lymphatic markers in the cysts. There are lymphatic vessels throughout these lungs, and we also know that VEGF-D, which is the growth factor responsible for promotion of lymphatic vessel growth, is increased in the serum of lamb patients. So we've been interested in the role of the matrix in regulating lymphangiogenesis. And one of the proteins that has been very well characterised in terms of regulating angiogenesis is the Collagen IV family. So there are 6 members of the Collagen IV isoforms that are called alpha 1 to 6, and they form triple helical complexes with 2 of these other chains. Each chain has a 7S domain, a central triple helical domain, and this non-collagenous domain referred to as the NC1 domain. Proteases, especially MMP9, have been characterised to cleave this NC1 domain, and this is then made into a soluble bioactive domain, which in the case of many of these collagen IV chains has been characterised to have anti-angiogenic activity. So we were interested as to what was the composition of the collagen IV chains in the lung, and in particular in the lungs of individuals with LAM. So we found in the lung that, it's not projecting particularly well, I'm sorry, but there's all 6 alpha chains are present in non-diseased individuals. But when you look in individuals who have LAM, the alpha 3 and the alpha 5 chains are absent. The alpha 3 chain has previously been characterised and is known as a molecule called Lamstatin, and it has a significant role in the regulation of angiogenesis, but nobody had previously looked at the role of the alpha 5 molecule. So we expressed this protein, we quantified the staining and found that there was a significant reduction in the alpha 3 and the alpha 5 chains, and this was scored by 3 independent blinded observers. So we expressed the alpha 5 NC1 domain and referred to it as Lamstatin, and found that when we applied this to lymphatic endothelial cells in the cell culture environment, and also to smooth muscle-like cells derived from LAM individuals, that Lamstatin decreased the viability of these cells. You can also do in vitro assays to assess the beginnings of the lymphatic vessel formation, is referred to as a tube-forming assay, and Lamstatin was able to inhibit these cells in these experiments also. We then went into a mouse model which involved putting the Lamstatin in a matrigel plug with some tumour cells, and this was then inserted into the ear of a mouse, and it was left there for 12 days, and after the 12 days the mouse was sacrificed, the matrigel plug was retrieved, and we had a look to see the development of the lymphatic vessels and the angiogenic vessels. So the blue is the lymphatic vessels, the green are the tumour cells to show the tumour development, and the red are the angiogenic vessels forming. And when we incubated these animals with Lamstatin at 2 different doses, we found that the development of the lymphatic vessels was retarded, but not that of the angiogenic vessels. And when we quantify this, we see that there's a significant reduction in the intensity of staining for the lymphatic vessels, indicating that this extracellular matrix protein is actively reducing the development of lymphangiogenesis in this model. So we think we're building a picture that the extracellular matrix is a key regulatory factor in LAM. We've seen that there's increase or changes in the matrix proteins, there's release of matrix proteins, and these proteins have the capacity to regulate lymphangiogenesis. So far, our picture is showing us that in LAM we have an increase in some of these soluble factors, a decrease in the anti-lymphangiogenic factors, which is increasing the amount of lymphangiogenesis, and we're also altering the profile in the extracellular matrix, which has the potential to change the behaviour of the cells that are embedded into that matrix. So as Keanu Reeves discovered, the extracellular matrix is the all-controlling entity that has the characteristics and the capability of regulating everything that happens. In closing, I need to acknowledge a large number of people who've made this study possible, especially the patients who generously donate their tissues for our research, and people all over the world who've contributed, including our funding sources. And in closing, Mr. Chair, I'll take your indulgence and just let everybody know that we have a postdoc opportunity in this project at the moment. So if this has excited you and you'd like to have this view out of your lunchroom every day, please come and see us.
Thanks very much. This is open for questions. Questions in the other room? Okay then, thank you.
Thank you.